my name is Kathleen Randall. I'm a student physical therapist with the University of St. Augustine. I'm going to be conducting a neuro evaluation, so I'm going to ask you a few questions revolving around why you're here and some past medical history. Before we begin, do I have your consent to proceed, and am I allowed to record this for school purposes?
Hi, I'm Phoebe Randall, and I consent.
Thank you. So what brings you in today?
I'm experiencing severe weakness and trouble with balance and coordination.
How long have you been experiencing this for?
About 4 weeks.
Okay. I see in your chart that was around the same time as your car accident. Is this where your symptoms began?
Yes.
I'm sorry to hear that. What medical attention were you given at that time?
I was rushed to the ER and I was diagnosed with a traumatic brain injury that affected both frontal and parietal lobes. And I had a fracture of the right superior ramus. They had drilled burr holes in my skull. I was hospitalized for 3 weeks and I was placed into a medically induced coma.
Well, you seem like you're progressing very well. I see that they also recommended you work with OT and SLP, occupational therapy and speech therapy. Have you seen them as yet?
No.
Okay. And did you have any imaging taken while you were in the hospital?
Yes, a CT and an MRI of my head. I had it uploaded to my patient portal.
That's amazing, thank you. And prior to this accident, were you independent?
Yes.
Did you have any limitations or restrictions in any activities before this?
No.
And what do you do for a living?
I'm a server at a restaurant.
Okay, do you have any hobbies?
Video games.
I love video games. What's your living situation at home like?
I live alone on a second-floor carpeted apartment.
Okay, and do you have any family in the area that can assist you?
Yeah, my parents are about 4 hours away, but they said they can help.
That's great. Are you aware of your family's past medical history?
Yes, my father has type 2 diabetes and hypertension, and my mom and my siblings are healthy with no known chronic or neurological conditions.
Okay. And aside from this injury, have you had any other injuries in the past, or have you fallen within the last 6 months?
No.
Regarding your past medical history, have you been diagnosed with anything, and are you currently on any medications?
Yes. Insulin, lisinopril 10 milligrams daily for hypertension, metformin 500 milligrams twice daily for diabetes, acetaminophen 500 milligrams every 6 hours is needed for pain, omeprazole 20 milligrams daily for gastrointestinal protection due to history of gastric issues, docusate sodium 100 milligrams daily for constipation management.
That was very thorough, thank you. Regarding your past habits, have you smoked in the past?
No.
Consumed alcohol?
I did socially. I'd have about 1 to 2 drinks per week.
Okay. And do you have any history of substance abuse or drug use?
No.
Have you experienced any fever, weight loss, or night sweats in the past?
No.
Any chest pain, heart palpitations, or dizziness?
No.
How about nausea, vomiting, abdominal pain, or any change in bowel habits?
No.
Do you recall your most recent A1C?
No, but my blood sugar is under control with my insulin management.
Okay. And have you noticed any neurological deficits?
I'm having difficulty with attention and balance, coordination, but I haven't had any seizures since my discharge.
That's a step in the right direction. Have you experienced weakness at all?
Yes, in both my arms and my legs. I find it hard to walk or stand up from my wheelchair at all.
Okay. Has that made you feel nervous, depressed, or anxious lately?
It makes me a little anxious thinking about my road to recovery, but feeling motivated.
That's great. And lastly, I would like to ask you, what are some of your goals with physical therapy?
I want to feel strong enough in my arms and legs to get out of this wheelchair and ingrain my balance and coordination.
Of course. I look forward to working with you, and we're going to do our best to get you back to where you were before this all started. It was nice to meet you.
Nice to meet you.